Let's begin with the clinical vignette. A 40-year-old male, Jack, who's a laborer by his profession, comes to doctor because of bulge in his right groin. He first noticed this bulge several years ago. Now he had only some discomfort in the groin region. This bulge became more prominent with the Valsalva maneuver, and on standing during surgery, the location of mass is identified and the mass is located medial to the inferior epigastric vessel, the most likely diagnosis of this patient. The location of the inguinal hernia. All the inguinal hernia are located above this inguinal ligament. Uh, all the inguinal hernia lie medial to the pubic tubercle. This is a pubic tubercle. And all the whether it is a direct or indirect inguinal hernia, they pass through this superficial inguinal ring. So that is basically the defect in the external oblique aponeurosis. So the inguinal hernia, on the basis of the inguinal canal anatomy, they're divided into the two types: indirect inguinal hernia and direct inguinal hernia. So basically, the indirect inguinal hernia, the hernia lies lateral to this inferior epigastric vessels, while the direct inguinal hernia lies medial to this inferior epigastric vessels. So the next difference is basically the congenital, whether the indirect inguinal hernia is basically the congenital defect due to the failure of the process vaginalis, failure of the process vaginalis in case of indirect inguinal hernia. Next is the passage. The indirect inguinal hernia pass through the both of these, the deep inguinal links, and this is a superficial inguinal link. The superficial inguinal ring is basically the defect in the external oblique aponeurosis, while the deep inguinal link ring is basically the defect in the fascia transversalis. So next important difference that indirect inguinal hernia pass through both the deep inguinal ring and superficial inguinal ring, while the direct inguinal hernia only pass through the superficial ring. The age of the patient of the indirect inguinal hernia is basically it may be infant or it may discovered in adulthood. So, in case of the direct inguinal hernia, the age of the patient, usually the older male, because it is a weakness in the fascia transferalis. Next, the indirect inguinal hernia follow the pathway of the testicular descent. Inguinal hernia is basically the most common hernia. Most common hernia. So the key of this clinical vignette is basically the location of the mass. The location is mass is a medial to the inferior epigastric vessel. So the right answer of this clinical vignette is direct inguinal hernia. If the mass is lateral to this inferior epigastric vessel, then it will be the indirect inguinal hernia. The right option of this clinical vignette is a direct inguinal hernia.